Patient is using a macrolides or whatever that prolonged acute interval, and is using another drug that also depletes potassium or depletes magnesium. A good example would be the loop diuretics, because loop diuretics leads to potassium, calcium, and magnesium loss in the urine. CYP interaction, they're always important. You're going to see here CYP inhibition and erythromycin and clarithromycin. The antibiotic that has the least inhibitory effect, would be azithromycin. Another important thing, avoid the concomitant administration of macrolides and antacids, or better said, macrolides and divalent cations like calcium, magnesium, iron, zinc, and so on. Why? Because in the GI tract, one binds to the other, they form a salt, and this salt cannot be absorbed. It prevents the absorption of the antibiotic. Do you know any other antibiotic that suffers the same kind of process? We mentioned it briefly during pharmacokinetic. No. The one that binds cations in the GI tract. Fluoroquinolones and tetracyclines. Right? Fluoroquinolones and tetracyclines. Same thing happens. It binds to the cation and it prevents its absorption. So if the question doesn't say cations, you need to look for antacids, which may contain magnesium, which may contain calcium, which may contain aluminium too. You might look for iron supplement, anything that increases anything that contains cations, right? If you need to use both the whatever antacid and let's say the antibiotic, you need at least 2 hours between the administration of one and the administration of other. Right? Worth mentioning, these antibiotics are safe to use during pregnancy. Not like tetracyclines, which are not like fluoroquinolones, which are not safe. These are safe. Tetracycline now. So I want you to think of tetracycline as very similar to their activity when it comes to bacterial coverage as macrolides, right? But more toxic. So here you have the tetracyclines. So tetracycline is both a class of antibiotic and it's an agent itself. Right? There is a tetracycline and there is the tetracycline family. So here we have tetracycline, oxytetracycline, then meclocycline, doxycycline, minocycline. I think these are the easiest one to recognize because of the cycline in the name. So where do they act? They bind to the 30 ester ribosomal subunit and they prevent the attachment of the transfer RNA. The transfer RNA is the one that carries the amino acid that is going to be attached to the growing peptide chain, right? So it's not the same exact mechanism of action, but it still binds to a ribosomal subunit. Look at the activity, gram-positive, gram-negative, and here we have chlamydia, mycoplasma, and rickettsia. The other one was chlamydia, mycoplasma, and legionella. They are actually effective also against legionella. Right? Their effect is mainly bacteriostatic. Here you can see the use again, respiratory infection. You see mycoplasma, chlamydia, you could add legionella. It's also effective against chlamydia trachomatis. So both azithromycin and doxycycline can be used again. You can use it against syphilis as an alternative to penicillin, especially if the patient has some kind of allergy, right? What's the bacteria that causes syphilis? Treponema pallidum, right? Treponema pallidum. Doxycycline and minocycline are also commonly used for acne, both locally and orally. And finally, it's also used against Helicobacter pylori infection. So you can see that the coverage is very similar to the coverage of the macrolides, right? Because they have the ability to eliminate intracellular bacteria. So now side effects. GI side effects, again, nausea, vomiting, nothing very specific. Here again, we have that problem with the interaction with divalent cations and these antibiotics, right? So if you were to mix both, it would lead to therapeutic failure because the antibiotic does not get absorbed, right? Photosensitivity, that's a side effect that is much more common with tetracycline and very rare with macrolides. That's why I was telling you that these antibiotics are more toxic. Food discoloration and animal hypoplasia. And this is why it's contraindicated in pregnant women, because it will lead to fetal malformations, right? And also in children below the age of 8 because of their growing teeth, right? Mainly the teeth, but there are other systems affected too. Rare but serious side effects, pseudotumor cerebri. Have you heard of this? Pseudotumor cerebri is basically the elevated or the rise in intracranial pressure, in the absence of a space occupying lesion. So there are multiple drugs that can give you that. Tetracyclines are one of them. We also have vitamin A derivatives. And yeah. Finally, I have the stereotoxicity, but it's not of big importance. So here the drug interaction again, the chelation with divalent cations mainly. Tetracycline may enhance the effect of warfarin, but that's again not that important. When it comes to drug interaction, I would like for you to know about the cation. Now, mechanism of resistance, you will see that there are multiple ways for the bacteria to resist to an antibiotic. Often, the mechanism of resistance involves the mutation of the binding site, right? So the bacteria is going to induce a mutation that will prevent the binding site to be recognized by the antibiotic. Another would be to chemically modify the antibiotic so that it cannot bind to its normal binding site. And then you have mechanisms such as efflux pumps, in which the antibiotic that is inside the bacterium is pumped out of the cell. What's the name of the protein that carries out this function in both bacteria, eukaryotic cells, prokaryotic cells, cancer cells? What's the name of the protein that has this specific function of pumping out drugs? The? No. It's coded by the MDR gene. We saw it in pharmacokinetic. Yeah, glycoprotein P, right? Glycoprotein P. No, it's P. Yeah. Aminoglycosides. That's a very important class of antibiotic because, of course, because they're commonly used, but more so because they're often linked, when misused, to kidney injury, acute kidney injury. Here you have the different agents that belongs to this class of antibiotics. We have streptomycin, neomycin, kanamycin, gentamicin, tobramycin, amikacin, and so on. So, mechanism of action, they irreversibly bind to the 30S ribosomal subunit, and they cause misreading of the messenger RNA. As a result, protein are not going to be synthesized properly. So, at low dose, they can be bacteriostatic, very low dose, but at normal therapeutic dose, they become bactericidal. To be uptaken by the bacteria, they rely on an oxygen-dependent transport. That means that these antibiotics cannot be used against anaerobic bacteria. They need to be used they can only be used against bacteria that uses oxygen. Because if the bacteria doesn't use oxygen, it cannot enter the bacteria. Now, uses, here you have a bunch of uses. What's important for you? First of all, they're going to be very effective against gram-negative bacteria. And actually, most of their use is limited to gram-negative bacteria. Then, one of these agents, streptomycin, is used against tuberculosis. And that's something you need to know. Streptomycin is an aminoglycoside used against tuberculosis. Then the other one is tobramycin. Why tobramycin? Because it's one of the only aminoglycosides which is administered, which is orally inhaled and given to patients with cystic fibrosis to decrease the severity and frequency of pneumonia. Patients with cystic fibrosis tend to develop